Louisiana Republican Senator Bill Cassidy is a medical doctor and sits on the Senate Finance and Joint Economic Committee. Senator, good morning to you and welcome.
Good morning, Sandra.
So as of now, no deal. The Senate will reconvene at noon. Americans are hunkered down in their homes across the country. What can you say this morning? What can you tell them to assure them politics will ultimately be set aside and the best thing will be done for the American people?
A bill will pass. I think what's required now is for Democrats to be honest. Clearly, there's money in there for health care. I've had conversations with hospital CEOs, et cetera. There's $15 billion to be distributed as best needed. The amount of payment coming from Medicare to hospitals for caring for COVID-19 patients has been increased by 20%. There's going to be billions more going to states through Medicaid. I can go down another list of things that are pumping money into the system. So the fact that Schumer would say that tells me he's hiding what his real objection is. He's got some other objection that he doesn't think the American people would be sympathetic with, so he kind of tries to distract with empty rhetoric. Let's hope. Let's hope Democrats kind of come to the table in good faith as opposed to hiding their cards and recognize that whatever short-term gain they're trying to achieve, it's not worth it. We got to reassure the American people, get the money to health care, get the money to individuals, get the money to employers.
Senator, with due respect, people hear your response and they hear a lot of politics. I mean, this is utter devastation in certain sectors of our economy. People are in pain. And meanwhile, on Capitol Hill, they wonder if the right precautions were made to even protect our own members of Congress. You see Rand Paul testing positive for the coronavirus. Now you have his colleagues Mike Lee and Mitt Romney having to self-quarantine because they had exposure to him. He apparently went to the gym and other places on Capitol Hill. So were even the right precautions made on Capitol Hill to protect our own members of Congress?
I think Rand's case, let me work backwards in that string of things, Sandra. Rand's case shows the importance of monitoring what you do. Someone who decides to stay at home after an exposure, after a significant exposure, not somebody across the room, but somebody with whom you've closely interacted, will save more lives in your local hospital because you don't infect other people and they don't infect other people, or else you don't get infected. So personal responsibility is key here. And so if you think you might have been exposed significantly, not across the room, but, kind of intimately, then stay at home. If you have symptoms, absolutely stay at home. That shows the importance of that. Secondly, I would say those who are self-quarantining are actually exhibiting that opportunity. Apparently, their interaction with Senator Paul was more significant, so they are self-quarantining. That's actually the appropriate action. Now, coming back to how we get through.
I think the problem was that he had already. Sorry, Senator. I think the problem was that he had already gone to be tested. There was fear that he had it, and then went to the gym, swam in the pool there on Capitol Hill, and there were still meetings happening, in-person meetings happening with Republican members of the Senate and Republican members of Congress. I'll let you respond to that, but I've got so much to get to here with you. Your state is going into statewide lockdown this evening. Louisiana, this will happen. What are you seeing in your state as far as the impact of all of this? And again, I present to people listening right now, you come from a very unique perspective on this. Not only are you a member of Congress, but you're also a medical doctor.
Yeah, so New Orleans has, I think, Louisiana has the third highest per capita rate. New Orleans is a hot spot. The attention is in the media markets, New York and California, but New Orleans is the one where it's happening. Our hospitals are filling up. We have the same situation as others. So we need supplies in our state. We need, the governor's asked people to shelter at home beginning at 5 o'clock tonight. So get the groceries you need and have them delivered tomorrow if you need them tomorrow. I go back to personal responsibility. If people make the decision to stay at home, the crest of this wave will pass relatively quickly. If we continue to go out, congregate, etc., not keeping social distance for those essential trips, then it's going to continue and be worse.
All right, all eyes will be on Capitol Hill today, as we know that Chuck Schumer and Steve Mnuchin will be meeting this morning, and then the Senate will reconvene at noon. The American people are watching minute by minute. Every minute counts. Senator, appreciate your time this morning. Thank you, sir.
Thank you, Sandra.